Here at Southwest Eye Care, we do a lot of upper and lower eyelid surgery. We find that the upper eyelid surgery helps relieve some of the obstruction that people notice in their side vision. And the lower eyelid surgery helps a lot of tearing problems as people age. The typical candidate for eyelid surgery is one who notices that they're looking through their eyelids or notice shadows superiorly, or they're just plain not seeing road signs when they drive. Other people that are good candidates for eyelid surgery are patients with chronic tearing and bulging lower eyelids.
I came to Southwest Eye Care because my eyesight's really important to me, and I wanted to get my eyelids lifted because I had hooded eyes, which was blocking my peripheral vision. I'd asked around to a lot of people. Everyone was saying that Dr. Stainer, he was the best at what he did, and so I came in for a consultation. He was very knowledgeable, and he educated me on what he needed to do to lift my eyelids. The procedure was great. It hardly hurt at all afterwards. I was really surprised, and I didn't have much bruising or swelling at all.
Procedures performed at Millennium Surgery Center under local anesthetic. Takes about 10 to 15 minutes to do each eyelid, and after about 30 minutes at the surgery center, the patient goes home, relaxes in their own environment, and puts ice on their eyelids to relieve some of the swelling. Patients are very happy with this procedure because it relieves that obstruction, and they notice a wider range of their peripheral vision. Usually the recovery time is 3 to 5 days, and people are back to work in that period of time. Typically all the sutures are removed within 10 days, and by 2 to 3 weeks following the procedure, most of their relatives, friends don't even know that they had the procedure done. It's a very rewarding operation for the patient.
Dr. Stainer was wonderful, great bedside manner. He was very good about educating his patients on the procedure step by step, and I had a lot of faith in him.
We use the matrix laser for treatment of acne rosacea, which is a very common condition of skin and eye. In fact, it probably involves the eye more than it involves the facial skin. The laser helps relieve the telangiectasias, improves the glandular function, and leads to more moisture on the eyes. So this is a new breakthrough and is really helping a significant aspect of our treatment for acne rosacea. The laser works by restoring glandular function and improving tear flow. We find that many patients have been very successful with the laser who have failed on different gels and different antibiotic pills. The laser procedure takes usually about 10 to 15 minutes, and afterwards the skin is erythematous or red. But within a few hours, usually about 4 to 6 hours, the redness goes away and ladies can return to work tomorrow, and no one will ever know they had the procedure done. Acne rosacea is a very underdiagnosed disease. People often will see facial telangiectasias involving their cheek, but they don't realize that's the underpinning or problem with their eyes. Sometimes they'll have very dry eyes and not realize that the dry eye and the rosacea are linked together. So by doing our facial lasers, we're able to improve the dry eye to the point where people don't need artificial tears. The laser has made many patients with rosacea extremely happy. Sometimes it will take 2 to 3 treatments, but nothing achieves the results that laser does. I think we're one of the few offices that do offer that procedure to rosacea patients. Other offices may offer gels and antibiotics, and that may work for a short term, but doesn't work for a long-term benefit. If people are interested in looking into a matrix laser for acne rosacea, everything begins with an appointment and a consultation.